Hi guys, it's Marvelous Akimu, a third year medical student of Delta State University. So are you a clinical medical student who just stumbled on this video? 30 advices for medical students, especially those in preclinical, to be precise 200 level medical students. Do well to watch the part 1 of this video so once again, welcome to my channel. Do well to hit the subscribe button if you have not subscribed. So in this video, I'll be giving another 10 advice to pre-clinical medical students, especially those who just got in, that the newbies 200 level medical students. So the first advice I'll be giving in this video is learn to read beyond your lecture materials. Alright, in as much as you'll be given slides, alright, some of them will give you slides. Don't streamline your reading to that slide alone. Okay, so this will help you become a universal medical student. So it will not just make you a medical student just for a particular university. And so, for example, you go out for competitions or you interact with other medical students in another school, and you'll be like, this thing did not teach us so. Meanwhile, you teach that particular topic. So the reason for all this is because you streamlined your reading to that lecture slide. I am always on the side of prioritize your lecture slide, and also on the side of read beyond your lecture slide. They are two different things, I know, and I also support the two of them. Alright, the second advice I'll be giving is differentiate between details and the big picture. So for every topic or for every course, or let's just break it down to topics. So for every topics in every course, all right, there is a big picture and also the detail. Know when to use details. Some medical students are so interested in details. At the end of the day, they so much know details without knowing the big picture. The third introduction to the bony structure, which is osteology. Right now, osteology is a concept that you must know. Okay, now the big picture here is the arrangement, all right, and the details is each of these. But let me say we are taking osteology of the upper limb, and it starts with clavicle. You see some persons will use 3 days to read just clavicle, and it will, like, I did that actually when I was in that stage. I did that, but now I'm like, Jesus Christ, did I actually read clavicle for 3 days? That's because you were focusing on details, and trust me, you will never see what is clavicle in any exam. It's so painful. So try as much as possible to differentiate between details and also know the big picture, even if you are so particular about details. Another dangerous thing about just doing details and not knowing the big picture is the fact that sometimes in exams you end up discussing things that you are not asked to discuss, and so they just tell you write on the axilla, and because you are a detailed person, you start writing from upper limb down, from shoulder region. That's where you started your answering from. At the end of the day, you see that you might not even have time to answer axilla. And trust me, in some schools, like my school, you have failed that question because you just deviated from the question you were asked. So in as much as you love details so much, ensure that each of these details you are learning, you have the bigger picture of all those details. Alright, so the third advice is practice active recall. So what exactly is active recall? Trust me, the first time you are reading a particular concept, whether you are seriously reading it or you are not reading it seriously, to your brain it is a passive form of reading. But when you keep on doing it over and over with the same concept, your brain takes it seriously and moves it to the long-term memory. So there's a separate video I created on active recall and spaced repetition. As a medical student, it is one study technique that you must not joke with because the workload is very voluminous, and for you to have a lot of information in your brain without forgetting it is active recall. And so that's why you see medical students 200 level to be precise, it is too voluminous. How will I put it in my brain? The one I read yesterday, I've forgotten it and I'm reading a fresh one today. The reason is because, trust me, your brain is not a machine. Okay, and so because your brain is not a machine, to help your brain you have to actively recall the stuff. So do well to watch my video on active recall and spaced repetition. So the next advice I'll be giving is master anatomy with drawings. Alright, anatomy is so voluminous. It's so interesting because it's intriguing. Imagine you just reading a particular concept and you're like, wow, this thing is actually in my body. So it actually brings this curiosity, right? But trust me, if you don't master some of these concepts using diagrams, drawings, you will just end up forgetting them. So one of the cheat codes I use for anatomy most especially is have a mental picture of almost all the concepts. So there's no concept I will read in anatomy that I don't have a mental picture of it. Liver as an organ, I have the picture for liver. Heart as an organ, I have the structure for heart. I have it. So by the time you ask me a question in the exam and you're like, heart, discuss heart, any diagram you put in your exam as a medical student has a particular mark. In fact, in the closed marking system, there is a mark allocated for drawing. So imagine you not putting the drawing. This drawing should not be a professional artistic drawing. Okay, it's something that you can just visualize. Most of the time, I don't even learn this drawing. Learn anatomy with drawing. Each of the concepts you'll be doing, have a mental picture. Now, don't try to cram drawing, or don't try to waste time to learn how to draw, because most of the time you now see that students will start dedicating time to learn how to draw. You just end up slowing your pace. Okay, so just anything you read, just try to have a mental picture of it. Just a sketch, just draw the sketch, because trust me, there will be no time for you to start drawing professionally. At the end of the day, you waste time, so you just need a sketch. The next advice I'll be giving is build small study groups. Study group in med school cannot be overemphasized. Trust me, it is one of the cheat codes that most medical students use. Check it out. Most medical students who do very well in medical school, they have a study group. Check it out. They have a study group, and try as much as possible to ensure that the study group you find yourself in, they are serious-minded people and they are also active. This alone pushes you to do so much. For example, your course mates are talking about axilla and you have read axilla. It's a kind of revision for you, okay, and gives you confidence to prepare for the exam. Then the next advice I'll be giving is more like a study technique, which is record your own voice. Record your own voice. The day I got this cheat code, in fact, it was amazing, but trust me, it works like magic. Record your own voice. So after you read the concepts, I'm not saying you should do it for audio subjects, or rather audio courses and audio topics. There will be no time set for you to really listen to all these voice notes. But for some particular concepts, alright, do well to record your own voice. Not recording your own voice reading from a note or reading from a textbook, but read that concept, know the concept, and summarize in your own words. Alright, summarize in your own words, listen to it, play it. It might be when you are sleeping safe, play it. It might be when you are playing, play it with your AirPod, your headset, anything. It might be when you are just doing your house chores, washing, or doing something, just put it in your ear. Listen to it. In fact, to get to a time, your brain becomes very used to your voice. If your brain recognizes or understands your voice better compared to other voices. And the next advice is be flexible with your study method. Right? Trust me, as a medical student, if you have just one study method, then I need to question your but trust me, you need to have various study methods, because there are seasons and there are times that study methods that worked for you in 100 level, study methods that worked for you in secondary school will no longer work here. Alright, so I have seen a lot of medical students who be like, I can't read in the night, I can't read in the night, I can't read in the night. But it is very obvious that it's only night reading that can help you solve this problem. What do? Switch to reading in the night. Okay, so in that sense, try to be flexible with your study method. Don't say this is what I've been doing since I was born and I'll continue to do it. No, you will be so shocked. Medical school will shock you. So one thing you must take note of is try as much as possible to research on more study techniques, learn more. Don't forget the active recall and spaced repetition I talked about. The link is in the description button. As funny as it's going to sound, sleeping is part of studying. Trust me, but don't trust me. Sleeping is part of studying. Now don't go and say, oh, he said sleeping is part of studying, and you sleep throughout the whole day and say, oh, you wake up the following day and you say, yes, I've studied. No, that's not it. When I say sleeping is part of studying, is sleeping helps your brain that studies. So then the ninth one is don't neglect your mental health, because of the way the system has been built, the voluminous workload and a lot of things, a lot of other factors, alright? But trust me, you must make sure you take care or be sensitive to your mental health, because the chances of a medical student going into depression is very high. It's very high. You just see some set of people, medical students, who they don't even feel anything, like they don't really feel, they're just there, and whether they pass or they fail, they feel nothing happens. But majority of medical students, it might just be probably you read so well, and as usual pass mark is 50 and you got 50 on the dot. Some people will still feel depressed for getting 50 on the dot, that they did so well. Right, so that's why the chances are very high. And at the end of the day, you feel emotionally down. So what exactly you need to do is, like I said, hold God tight. And secondly is have good friends around you. Have good friends around you. Trust me, they'll be the one to lift you up eventually. Again. So when you cry out to God and say, God, please help me, God will not say, okay, those friends around you, let me touch them, so that they are going to help my daughter or my son. So at the end of the day, you are helped by the friends around you. But trust me, if you are a loner, you don't have friends, you fall into depression secretly, and that's the way the depression will keep on eating you secretly, and nobody knows about it. So that's why it's very, very important. Medical school is teamwork. Medicine is teamwork. So while you progress in this journey, do well to have somebody, have people. It might be a senior colleague, it might be just have people. And you know that when you are emotionally down, this person will be there to say, don't worry, we'll be there. Alright, do it this way, do it this way, do it this way, do it this way. And that's what makes medicine much easier. Advice for this video is start practicing exam question earlier. Alright, so this actually was a disadvantage for me in 200 level when I wrote my first continuous assessment. So a lot of things, coming as a 200 level student, and that's why I'm making sure I do these videos so that people don't end up falling into this situation I fell into. So I did not practice exam. I did not do anything like practicing exam questions for my first CA. But yet they were past questions. Trust me, I was so busy doing things, reading, doing other things I need to do. But I skipped not practicing past question. So to tell you the efficiency or the importance of practicing past question, and what happened was that for my first CA, about 3 questions that came out in my first CA was from past questions. Now I would have come out regretting, because it's very painful when you don't study past question and you come out of the hall and your classmates are like, thank God I read the past question, and you be like, Jesus, which past question? Did that past question now? It is so sad, trust me. But just because I knew the answers to the question, I did not really feel it. But who knows, you might not know the answer to the question. So that is why studying these past questions on time help you know, this is how they set question. So as a medical 200 level medical student, you're not going to be reading clavicle for 3 days, then you read axilla for 20 minutes. So but from past question, you see that these are the set of questions that they can ask. This is set of questions they can't ask. So this is what I should do, this is what I should not do. So practicing past question early helps you soar in the exam. So I've come to the end of this video. If you enjoyed this video, do want to give this video a thumbs up, comment in the comment section. If you have a question for me in regards to how you will survive preclinical, most especially if you are in 200 level, do want to drop it in the comment section, and I'll be so glad to respond to you. So see you in the next video, and don't forget to watch the part 3 of 30 advices for preclinical 200 level.